World Health Day is celebrated on April 7th every year, a day dedicated to shedding light on the importance of leading a healthy lifestyle. And this year's theme is Our Planet, Our Health. This year, World Health Day is celebrated with the ongoing pandemic and pollution growing on the planet, diseases like cancer, asthma, and heart diseases increasing rapidly. Now, to talk to us about the relationship between food and the environment, we're now joined by Mbali Mapholi, who is a clinical dietitian. A very good afternoon to you, Mbali. Thanks so very much for joining us here on SABC News.
Good afternoon, Flo. Thank you so much for having me.
You're most welcome. Talk to us then about this relationship between nutrition and the environment. Certainly seems like two separate issues, but they do join at some point, don't they?
Yeah, they do. What we've seen with the pandemic, and you've just mentioned some of those things, was obviously the increase in chronic diseases, or what we call the non-communicable diseases, like your heart disease, diabetes, and some cancers, just to name a few. And what we saw is that, especially the World Health Organization, the WHO, is saying there isn't that link between people being more exposed to these diseases, but also the environment over time, whether it was because of the pollution or the climate crisis that we are facing with. All of that meant that now more than ever, especially post-pandemic, protecting the people themselves. So an urgent call for active collaborations or collaborative actions to help keep the environment healthy, or our planet healthy, but at the same time focus on human health. So I think this then says there might be not that direct link for one to say, because of this has happened, but we see a just overall need for all hands to be on deck, whether it's government, whether it's corporate, it's countries, communicating amongst themselves to just help, when it comes to people's health for the betterment of humanity, to bring all those expertise together.
Yeah, you talk about that collaborative action between governments or private sector, whoever it is, but in what form would that help that you speak of take place? I mean, I think that, we've seen the awareness campaigns and we've seen, people being told to take better care of the environment and so forth. And certainly we here as media try to do that too. But when you're talking about more help needed, in what form, how would that help come about?
So, 100%. We appreciate, as healthcare professionals like myself, who have this mission to educate people on healthy eating and healthy lifestyle. Such platforms are very much important. And I think how we deliver the message needs to evolve. It's all good and well to have these campaigns, but the deliverance is not progressive and it's not fitting to the current ways of living, if I can put it that. So, for example, if you're saying how, I'm thinking, for example, my colleague and I, so Azzy Boy, who's a dietitian, and I, literally today are launching a collaborative nutrition and health expert podcast called the Dietitian Frequency. And it is in such initiatives that we can all be saying we are doing something. So podcasts over the pandemic have become such a growing mode of communicating messages to Generation Z, for example. So so government cannot just now, or whoever is communicating these messages of healthy eating and how it affects our health and how everything ties in together, including now the health of the planet. We can't now print out papers and just leave them lying around, because we've become a digital society. So hence podcasts and more inclusive ways of communication, whereby in the past, we would have said healthy eating perhaps is only about eating broccoli. But in 2022, we need to be more inclusive and say it is okay to eat your cultural foods so long as you're still achieving what is important, which is health. And those type of narratives and approaches are, in my view, what I think is going to help us get the message to the people as far and wide as we can get it to the people.
Yeah, and how does one actually know, which diet is right for them? I mean, one can consult with a dietitian yourself, but from my experience, it's not always cheap to consult with people like you, and not everyone can in fact get the services of a dietitian. And on the back of that, there's this complaint, and I'm sure you've heard it quite often, that sometimes people just grab what they can afford at the end of the day, and sometimes healthy food is just so expensive as compared to just sort of taking whatever that is available that might not necessarily be healthy for you?
Here's what has caused healthy eating to be expensive. It's because as a society, maybe driven by the weight loss industry, we've now sort of thought the only way to achieve healthy eating is eating specific foods that we can't even afford, foods that we don't even enjoy. But when we break down the actual healthy eating, as a health and nutrition expert myself, it is about that. It's just the concept of finding nutritious foods. I often make an example with salmon and canned pilchards.
Yeah.
Many people will say healthy eating is only about eating salmon. And then whenever they are eating canned pilchards, it seems as if they are downgrading or it's not healthy enough. But the truth of the matter, in the essence of nutrition and health, canned pilchards are as nutritious as salmon. You're getting the omega-3 and protein and what's not that you're looking for. So when you're looking cost side by side, then essentially healthy eating is not costly. Is now how we've been educated, and that's why we say the change of the narrative and the voice around that is important. And then when it comes to dietitians, luckily, and at the community level, there are nutritionists. So nutritionists, they practice preventative care. So they will educate people on what to do. And then when there are complications, that person is then referred to a hospital setting where they can see a dietitian, but also in private practice. I mean, if you find a dietitian like myself who is has positioned themselves in a more niche way and are focused specifically on gut health, price maybe might be a thing there. But generally, there are different types of dietitians with different types of offerings. So I always say, go to social media, look and have a feel. And once you vibe with the dietitian and you agree with their ethos, then you can choose that dietitian. And often, if you vibe with them and agree with their ethos, even the education they're going to give you is relevant to your pocket. It's also relevant to your cultural background, for food preferences, around those things. So it's just about finding the right person. I think when it comes to dietitians, the face has always been a person who's so posh, who is a different kind of a human being who's got a specific type of a body. But today we know there are dietitians who literally look like the majority of South Africans. There are dietitians who come from humble backgrounds like myself. We understand the struggle. And if you consult with such, healthy eating is not going to be posh or out of reach, but it's going to be relevant to you.
Yeah, and then let's talk briefly. I mean, you've touched on it a little bit, but what are some of the simple sort of ways that people can improve on nutrition today, and not just in the aspects of weight loss, but really in terms of taking care of one's health?
And I like the fact that you said put weight loss aside for a second, because the focus is always on weight loss, but health is important. What I'm going to mention quickly four. The first thing is to buy local. If we can try to buy what is local, then in terms of affordability, we are able to match up nicely. Secondly, try to buy seasonal. We tend to see that seasonal produce is cheaper at that time, but also nutrition-wise, I'm going to make an example, citrus fruit, which comes now in autumn, winter. It's packed with vitamin C, and it so happens that vitamin C is one of the important nutrients to support immunity. So somewhat we can say nature gives us what we need when we need it. And then the third thing that one must try to do is to close the noise. There's so much noise out there, and some of that noise comes from the not multimedia, but social media platform where you are interacting with people from all over the world, which is great. But when it comes to healthy eating, that somewhat makes people think the only way to eat well is to eat European food, for example. But when we use that and say for inspiration, but bring it closer to home, cultural foods that we love and enjoy, that we can easily access. And then the fourth thing, which sometimes also is a problem, is most people fear canned foods and they fear frozen foods, especially when it comes to produce like vegetables and fruits and legumes. I must tell you now, hear this coming from myself, a nutrition expert today, when it comes to science, those foods, frozen and canned foods, they are affordable and they last longer because you can store in the freezer, and their shelf life of cans is longer, can definitely be part of a healthy diet. So those four things are what South Africans can try to just implement ASAP, because it's just a matter of now, the next time you go to the shops, don't try to buy something that clearly states that it is not seasonal and you see the price. Rather buy what you can that is offered in that season.
All right. Thanks so very much for giving us your time. Mbali Mapholi, clinical dietitian. It's been a great pleasure talking to you. Thank you.